The aerFree system is simple and easy to apply and use on patients. Each unit includes the following: a soft, flexible silicone collar, a vacuum port which will be connected to the vacuum source, a reference arrow on the collar to indicate proper positioning of the collar, and color-coded vacuum tubing. Remove the aerFree AMS collar from its package. Attach the blue connector of the tubing to the vacuum regulator. Occlude the end of the white connector and adjust the vacuum regulator to -45 centimeters of water or -33 millimeters of mercury. Note that when removing your finger from the end of the white connector, it is normal for the vacuum gauge to show a lower level of vacuum. The vacuum tubing must be occluded to accurately set operating vacuum. Attach the white tubing connector to the collar port, making sure it is securely inserted. Vacuum should be continuously on during patient placement. Prep the patient's skin using one or more alcohol wipes, wiping the area where the collar will be applied. The skin should be dry prior to placing the collar. Remember to make sure the vacuum is turned on and set to -45 centimeters of water. Make sure the patient is in a supine position. Place the collar under the patient's chin, with the arrow pointed up toward the patient's nose. Holding the ends of the collar, rotate the collar until the lower flange contacts the patient's neck. Then allow the ends of the collar to contact the patient's neck just below the ears and as parallel to the mandible as possible to create an airtight seal. If the lower flange contacts the patient's neck above the thyroid notch, the collar should be repositioned slightly lower on the patient's chin. Make sure that the collar is not folded over itself or touching the patient's ear. Verify that the vacuum gauge rises to -45 centimeters of water or -33 millimeters of mercury. The vacuum should securely pull the collar into place if properly sealed. If a patient is repositioned while using aerFree, verify that the vacuum gauge continues to read -45 and that the collar is not dislodged. At the end of the procedure, after the patient is no longer at risk of airway collapse, the collar may be removed by simply lifting one edge of the flange and peeling the rest of the collar off. The collar should be discarded in accordance with your facility's policies.